Hi everyone, and welcome to our channel, where we're dedicated to educating you about the ultra-rare disorder known as Type 1 Plasminogen Deficiency, or PLGD1. Today I'm going to go over the key signs and symptoms of this condition. If you or a loved one are experiencing any of these, be sure to talk to your doctor about testing for plasminogen deficiency. In most cases, a simple blood test can provide the answers you need. So what exactly is plasminogen deficiency? In Type 1 plasminogen deficiency, the body doesn't produce enough plasminogen, a critical protein involved in wound healing and breaking down unneeded scar tissue, or fibrin. Without enough plasminogen, the body can't clear away this excess scar tissue, and this leads to whitish, firm growths or lesions that can appear in various parts of the body. These lesions can become quite large, causing scarring and irritation, and ultimately they can prevent parts of the body from working as they should. For instance, growths on the eyelids can cause scarring, leading to vision loss. Growths on the gums can weaken teeth and sometimes even cause them to fall out. Lesions in the ear may lead to hearing loss. Growths in the lungs can make breathing difficult and increase the risk of pneumonia. Now, I know that all sounds pretty alarming, and it can be, but the good news is that there's an effective treatment available. A medication called Replazime, given through IV infusion, supplies the body with the plasminogen it's missing. This treatment can help the body break down scar tissue and protect organs from damage. Replazime is currently available in the United States and is expected to become accessible in more countries soon. Let's break down some of the common symptoms of PLGD1 and how patients often describe them. We'll start with eye symptoms. Most patients begin to notice symptoms in their eyes, and these appear as whitish growths under the eyelids, which can look firm, slimy, or mucousy. Here are some descriptions of these growths from real patients. Thick white eye boogers, constant pink eye drainage, white lesions under the eyelids, bleeding under the eyelid, allergic conjunctivitis, or membranes on the eye. Next, let's talk about gum symptoms, which are the second most common area for lesions. Patients have used these descriptions of their gum lesions: white growths around teeth, ulcers around teeth, white spots that won't come off the gums, bleeding gums with white spots. As you can see from this list of descriptions, sometimes the first symptoms of PLGD1 are not very specific. In fact, this disorder can be tricky to identify for several reasons. First, symptoms can be vague. The early signs are often subtle and can vary greatly depending on where in the body the lesions form. Some of the things that patients are diagnosed with before getting a diagnosis of PLGD1 might include recurrent pink eye, blocked tear ducts, adenovirus infection of the eye, aphthous ulcers of the gums or canker sores, or thrush, which is a yeast infection in the mouth. It's also difficult to diagnose because there are a wide range of affected areas. Although eye symptoms are the most common, lesions can also appear on the gums, in the nose, the airways, the kidneys, and other parts of the body. And symptoms may appear at any age. Some people show signs soon after birth, while others may not experience symptoms until much later in life, even into adulthood. Finally, PLGD1 is extremely rare. Because it's so uncommon, most doctors are unfamiliar with it and might explore other causes for the symptoms before considering PLGD1. All these factors mean that getting a diagnosis can take time, but it's not impossible. We hope that by providing some examples of how real patients described and searched for their symptoms of plasminogen deficiency, it will help other patients to find this potential diagnosis more quickly. And with videos like this, our goal is to increase awareness and make it easier for doctors and patients to recognize PLGD1 sooner. Remember, as patients or caregivers, we sometimes have to advocate for ourselves. If you suspect PLGD1, don't hesitate to bring it up with your doctor.